say welcome to everybody. Thank you for being here. I'm sure a few more people will roll in. You are at the San Diego COVID-19 Funder Response Update, one of the many that you've probably been on this week. And to start us off, I'd like to hand it over to Debbie McKeon, who's the President and CEO of San Diego Grantmakers.
Thank you so much, Megan, and thank you to each and every one of you for joining. It's great to see so many faces at a time when we're all in our own places, so that it's good to be connected this way. And I think as I think about these weekly calls, what has been so important to really lift up is that every week we see the funders, the philanthropic funders, the impact investing funders, government, nonprofit sector service providers coming together to really create the best collective responses that we can at this time of the COVID-19 crisis. So I just want to thank each of us who joined today as we talk about a topic that's especially important in our community, and it's one that we were facing before, but COVID-19 creates some very specific higher risks for our community members who are currently experiencing homelessness. And so with us today, we've got leaders from government, philanthropy, cross-sector task force, and the service providers who are going to talk with us, not only about their insights and their updates, but also about responses that are underway. So with that, I'll turn it back to you, Megan, so that you can kick off the program.
Great, thank you so much. Oops. Sorry, you're here in my Slack. So here we are today. Let me see if I can share the screen up. Okay, so if you are seeing the title of the presentation you expect to be at right now, then you are in the right place. And as they say on the airplanes, if you're not trying to go to this presentation, feel free to log off and go wherever it is you were trying to be. Just one note is that we are recording this webinar, which means two things. One is that anything we talk about here will be on a recording and be made available to the public. Secondarily, if you want to go back and revisit this conversation or share it with somebody else, we will have it available on our website, along with the recordings for all of the other calls that we've done in the past, and we'll continue to do as a resource. My name is Megan Thomas. I am the Vice President of Collaboration and Special Initiatives at San Diego Grantmakers. And we're just so happy to have you all here today and appreciate you taking your time, and in particular, the folks who are going to share with us today, taking some of their time to talk about what's going on in our community. So we wanted to start with just taking a little bit of our precious time to do an exercise that we like to undertake at San Diego Grantmakers, which we call grounding in. You may think of it in other ways, but really just to take a few deep breaths. It's a nice physical, mental way to arrive here. Try and bring that stress and tension down and leave it to the side, not because we're not going to attend to it, but because it's so important. So I'm going to lead 3 breaths and follow along at your comfort level. So just together, if we were to breathe in and out. Probably have some tension in your back or shoulders. You could let that go and breathe in and out. And then one more time, in and out. Okay, thank you so much. Just a few moments to hopefully let us relax into this conversation. You know, we're going to be talking about where we find home, where we find shelter, where we find peace today. And it's important, we believe, to acknowledge that wherever we're sitting in our home offices, and some of you are actually in the office doing your work, is that we're on the land that is the traditional and unceded territory of the Kumeyaay people. These are people who have known disease, who have known pandemics, and so often are overlooked. And so we really want to center that as part of our consideration of what actions philanthropy is taking who we are as a community and how we're considering our most marginalized and resilient communities, because these are our neighbors still today, and they themselves are also with us in this pandemic. So thank you. With that, let me see if I can advance this slide a little bit. You are all probably tech experts, Zoom, Ring Central, GoToMeetings, whatever platform you use, but just as a reminder, please go ahead and stay muted until we get to the discussion portion, but you can talk to everybody using the chat function here. You can enter your questions and we'll try our best to get them answered. You can also see who's on the call with us by clicking that participants button. Oops. So this is our very brief and focused agenda for today. We are about to finish the welcome and introductions, and then we will go to our speakers and engage in some questions and discussion. These are the folks that you'll be hearing from today, and we're so just pleased to have them with us to share the latest information. And with that, we'll get to that at the end. I'm going to stop sharing my screen. Excellent. And I'm happy to introduce Councilmember Chris Ward from District 3 of the City of San Diego to share a little bit about the efforts there. Chris, please take it away. Thank you so much.
Great. Well, thank you, Megan. And it is really a pleasure to be here with you. Thank you for having me be one of your participants here today. And I want to thank you all for your attention to how we're responding to COVID-19. It's truly been a collective and collaborative effort between us at the City of San Diego. You'll hear soon from Supervisor Fletcher and many of his colleagues at the County of San Diego. As well, you'll hear from Tamara Kohler, our CEO of the Regional Task Force on the Homeless, and the officials from the Housing Commission, philanthropy, the general community. Everybody has come together to really focus on making sure that we are being intentional about how we respond to homelessness and the particular vulnerabilities that they have under the state of COVID-19 response. We established a homeless operations branch working out of the city's emergency operations center just about 19 days ago. So to think that not even 3 weeks ago, we hadn't had all of this response be able to come together. And in that time, so much has happened, really been a model of how we should be working together collaboratively across the region. As you are well aware, because I'm sure you're all following the news, we made a decision to open the convention center to provide and accommodate the social distancing practices and support staffing needs across all of our bridge shelters. So between Father Joe's Villages, Alpha Project, and Veterans Villages, we wanted to make sure that we were using those resources most effectively to reach the most individuals. And the plan was to create more space so that there would be adequate physical distancing. This was intended to be a multi-phase process. So it began with those 3 large bridge shelter clients coming to the convention center, which we just on Tuesday actually brought the final cohort in. So now we have a little over 800 individuals at the convention center. We are conducting ongoing screening processes for everyone accessing the convention center to make sure that the clients there stay healthy and safe, and that the workers stay safe as well. We also on Tuesday, City Council approved looking at $3.7 million in emergency state funding, which is going to go towards the convention center operations. So the county is putting a lot of its allocated resources. The Regional Task Force, as our COC, is putting some of its resources that we're all getting from the state towards this effort to really maximize those dollars. We do intend to have future phases to address more unsheltered individuals, and we are going to be refining that and sort of deploying those strategies over time. The Regional Task Force and the Housing Commission and all of our partner agencies, again, really want to focus on exits. Now that we've got everybody in one place, we want to make sure we don't let go of what was always intended to be the primary focus of this, which is housing navigation, and make sure that we are having positive exits from the convention center. What else can I say? The task force is coordinating with the county to place, I think, about approximately 300 people now in hotel.
We'll give it maybe a few seconds to see if we get him back. This is the new version of the Point Loma pause, right? We don't pause for planes, the technology pauses us. Well, let's go ahead then and we'll see if he comes back and let him finish up that thought. But Tamara, if you are ready to share with us the view from the Regional Task Force on the Homeless, we'd love to hear it.
Thank you, Megan. And I thought maybe it was just me that mine paused, so I'm glad it's everybody. You never know in these. I'm going to pick up kind of where Chris left off. I'm going to back up just a little bit. We began seeing the coronavirus issues happening internationally and began kind of collecting our thoughts and thinking about how, as a community, we should be addressing potentially a virus outbreak in our community. So we had an emergency meeting with our Regional Task Force Board on March 11th. It was one of the last convening meetings of people that I had the opportunity to participate in. And at that meeting, we had Mayor Faulkner there. We have Supervisor Nathan Fletcher, who is the vice chair on my board, and Chris Ward, along with our 31 board members, but also our leading public health leaders. We had Red Cross, we had 211, we had United Way in the room, we had all of our large service providers to really begin to frame up how we would coordinate our efforts. And we began collecting the national strategies and best practices to prepare to address an outbreak, really following the CDC's guidance. And as Chris said, leading in that space, really collectively with the city and the county and the regional task force, we began to frame up what would be an appropriate response. So the response that you're seeing in the city is actually a strategic plan following CDC guidance. So social distancing was our primary role and purpose of the convention center. We had the opportunity to have a number of bridge shelters that are downtown, including other shelters that were not meeting the CDC guidance. And it really was under that flattening the curve, being very intentional, but also trying to look at nationally practices. Was it the right thing to do a large congregate site? Some things about the convention center you may not know. We have the full convention center floor. Those bridge shelters were brought in cohorts. So we brought in Alpha Project's 2 bridge shelters as kind of communities. We brought in BBSD as a community. We brought in Father Joe's as a community. We also have supported our partners at the Rescue Mission when they lost staffing and were no longer able to do their shelter. We brought their cohorts in. And then the piece that Chris, I think, was just leaning in on is the hotel part of the strategy. The hotel strategies and the convention center strategies were all based on CDC guidance for social distancing to reduce the spread and to really mitigate an outbreak in a population that was too closely associated, also increasing our ability to provide good health care, to provide that sanitation and hygiene needs. The reason that the convention center was such a solid option is twofold. One, we had really good and willing leadership at the convention center with Rip and his team to lean into this work and meet us more than halfway. The convention center has the ability, sewer, water, they have a team that stands up literally a city every week as they set up their conventions. So we had the ability to keep their teams employed as well, and the economic engine of that. And their ability to do the food for these populations were important. So being able to hook up shower trailers, laundry, our homeless population being able to use real bathrooms, not porta potties, sinks where they could wash their hands, get good guidance on good hand washing, good hygiene, don't touch your face, health screenings that happen there. We have the county showed up in spades at the convention center with mental health, behavioral health support, and healthcare. So we have 2 public health nurses that are on site, but we also have the depth of mental health support. When you have people in a congregate site, that is the support that's desperately needed. So it is this very intentional and deliberate setup that has been done within the convention center to reduce the spread of the virus, but also to give those individuals who are sheltering there safe, appropriate hygiene and support. The hotels are a FEMA response. So I just want to give you guys some clear directive on the hotel response. The county has nearly 2,000 public health hotel rooms. That is a FEMA response, and they are very specific of how they can be used. And so it is not an unsheltered homeless response. It is really there for a public health response. And the 1,500 rooms that the county have are for people who need to be isolated or quarantined. Is a very different hotel type of sheltering, where they are not getting the housekeeping every day because there is a risk of exposure, and that is really supported by public health. The hotel rooms that were carved off for the regional task force were forced to achieve social distancing and other shelter areas like in North County. And so we have been using that in an appropriate way, but those individuals in the hotel rooms must meet CDC guidance that they are 65 or older, or have an underlying health condition, or we're using it for social distancing. So there's, I think, some confusion that there's, thousands of hotel rooms out there for an unsheltered population. That is actually not what those rooms are for. But the rooms that we have secured have been to follow that CDC guidance. We have an unsheltered population that needs safe shelter, and we need to work on that more collectively. And we're moving towards that as the convention center will open soon to an unsheltered population. Two other pieces that I will highlight. The amount of federal resources that will be coming to our community for addressing the homeless crisis will be here in probably the next 60 days, and it's an opportunity for us to really think about how we reimagine our homeless response system with new resources. With a high and sheltered population, we're going to do a lot of good planning and coordination and leveraging those resources. As we've sort of consolidated the sheltering system within a convention center, we're also rethinking and reimagining how some of those shelter beds are being used. So we're using some potentially for respite beds and other things. So we're reconfiguring the rest of the homeless response system as we've sort of consolidated for staffing resources for both health and wellness. The importance of us being able to draw down all federal dollars, ask for all of the appropriate waivers for our federal funds, is a part of what the continuum of care of the regional task force does. Some of the waivers that are here for our community are being able to use our funds for higher than market rate rent, which will be a good thing in a high rent district type of communities like San Diego. An ability for us to serve people a little bit longer and reduce documentation, which sometimes is a barrier for us. We also have the VA showing up in spades, so our hope is that we get more of our veterans moving to housing. So just to kind of finish Chris Ward's thought, the exit strategy is equally as important as the strategy was to do the social distancing and to bring people into the convention center. So once we saw that that was working, we've actually pivoted the majority of our strategies and our talented team towards how do we move people to housing as quickly as possible and the most effective way that they stabilize. The job of making sure that we return the convention center to being an economic driver in this community is a part of that strategy. And the importance of us all as funders in this space to really lean into housing. This is a perfect time to humanize this lack of housing and shelter and support for those where when we all have a place to shelter in place to be safe from a virus, they do not. So one of the underlying messages is that this should be something that we walk away understanding that housing is a right and that we need to really lean in that space. And I hope that we move more people not safely into shelter, but at the end of this pandemic that we have found more housing resources, better coordination, and strong leadership that will lead us into that next phase of addressing homelessness.
Tamara, thank you so much. It's very clear, and we're going to go back to Chris Ward in a moment. He's reunited, but it's so clear that one of the critical aspects of this response is communication and coordination to make sure that we're all doing our best for the people in our midst. So I appreciate you drawing that out and recognizing that eventually we will come through this, and there are lessons to be learned and actions to be anticipated to really make sure we're seeing the recovery as part of the response. Chris, excuse me, council member,
That's
if you'd like to rejoin us, please. Thanks
No,
for.
yeah, and sorry to have lost you on a little power and Wi-Fi blip here, but I'm glad that Tamara had a chance to really get into more detail about the work that we're all doing together. I think I'll just step aside from the convention center and maybe just highlight that, on the streets and in the broader community, I think we've had close to 300 hand washing stations and about a dozen portable toilets. We're working closely with the county for the siting of additional locations so that we can make sure that sanitation is within reach of just any individual that needs it. We want to make sure that our public health nurses are deployed to shelters and are assisting the homeless outreach teams to educate individuals who are living on the streets and otherwise in our canyons and could be challenged by the state of being unsheltered and having particular vulnerabilities to COVID-19. We want to provide information on a regular basis so that shelter providers have critical facts such as CDC and HUD guidance. And we want to make sure that the Housing Commission and the Regional Task Force of the Homeless are putting all those updates and are holding coordinating calls with all those providers so that we can all be on the same page. We are trying to just daily assess our supply needs with homeless service providers. So we will never run fearful of running out of any of the critical sanitation or other daily requirements that many of these programs rely on, especially when supply chains can be a little bit disrupted and challenged. We want to make sure we're well ahead of that. We talked about a lot of the exit strategies and what's going to be coming forward for some of the hotel rooms. It's going to be always on the forefront of our mind to make sure that all the partners are thinking at the client level and making sure that we are getting everybody continuing to connected to permanent housing opportunities. Related to a lot of this, of course, is making sure we don't have more individuals falling into homelessness. And, it's a lot has happened in just not even the last 3 weeks. But if I walk it back about 2 weeks ago, we were a couple days ahead of the statewide moratoriums, in the city of San Diego, along with my council colleagues, passed an eviction moratorium for both residents and commercial businesses that were facing rent challenges as well. We hear loud and clear that there's going to be a real big issue coming up at the end of this emergency declaration. And how are we going to engage between landlords and financing industries and others that really complete the entire spectrum so that people are not evicted, that nobody's falling into homelessness, but that the whole systems remain whole? That's going to be an ongoing challenge for the city, state, and all partners in the like. We obviously in my district representing most of the mid-city areas have a number of small businesses, particularly in the restaurant and other tourism serving industries who are impacted as businesses, who have laid off workers. So we're grateful for the broader community that have really set up a variety of relief funds for many of those individuals who have lost employment, who are under furlough. And so, that I think all of us coming together is helping to make a little bit of a difference. And lobbying for state and particularly federal assistance is going to be a big role for the city to make sure that we can do all we can to help people weather this very difficult time. We have on the horizon the city's budget, which we already know is going to be extremely impacted, and that's an understatement. Just decimated based on many of the revenue streams that we normally would project for the next fiscal year. Already in this fiscal year's budget, FY20, just to get us to June 30th, we're facing a severe shortfall because of the reliance that we normally have on hotel tax, and sales tax is our second biggest contributor to the city's budget, is also taking a big hit. So we are going to be expecting the mayor's draft budget next week around the 14th or the 15th. I'm sure there will be cuts across the board. We are going to be looking towards a lot of federal, state, and philanthropy assistance to help with homeless-related funding, but we've got a lot of other areas of city interest as well that I'm going to be turning my attention to as well to try to keep things as whole and as productive as possible. We, as you all were following closely and many of you were engaged with, passed a community action plan on the homelessness late last year. That includes ending youth and veterans homelessness and reducing our unsheltered population by 50%. And with the also intention of building more housing units. I don't want that rhythm and that that interest that we had as a city council and collectively as a community to suffer any delay from those goals. So we and my staff and I and our community partners are still intent on making sure that we are adapting to the current environment, looking forward to the future environment, and how we stay attuned and not disrupted from being able to meet those goals. We have been certainly engaged as an office with a lot of the food distribution networks. As you saw in the news this week, normal food outlets for unsheltered are going are very limited right now, and we're hearing a number of stories of people going hungry on the streets. So we're working with local providers on food distribution methods and opportunities that I hope will be operating as soon as possible. That's another effort that we're actively engaged with this week. We're going to be requiring the support of outreach teams, food banks, possibly restaurant support. So it's definitely a effort that's in the works. So with that, I think it's kind of a little bit more of a broader range of issues. I'd be happy to answer questions on anything on the homeless response, city budget, a lot of things that are impacting our neighborhood services. And again, I want to thank you and everybody at San Diego Grantmakers for your interest and attention.
Thank you so much, and the same to you. I think we are all leaders in our own way in this situation on a variety of different scales, and it's great to have an opportunity to bring everybody together. San Diego Grantmakers has been very proud over the years to have the opportunity to speak across sectors and really try and create these spaces that we can bridge. And that's why after the first week, we realized these funder calls that we were doing really would serve our collective purpose better if we just opened them up broadly. So we have funders, community members, nonprofit organizations, government entities, all welcome and participating, and it's made for a rich experience. And with that, I want to hand the microphone, the virtual microphone, over to Amy Denhart, who is the director of Funders Together to End Homelessness San Diego, which is housed here at San Diego Grantmakers and a real leader in the field and across policy issues to provide some insight into how philanthropy is responding to this issue and the many that cross with it in our current situation. Thanks for being here, Amy.
Thank you, Megan. Hi, everybody. Before I get into the role of philanthropy, I just want to recognize how what leaders we have with Councilmember Ward and Tamara Kohler and Supervisor Fletcher. It's really been amazing how quickly the county and the city and RTFH have responded to this crisis. I mean, if you think about setting up the hundreds and, that couple thousand hotel rooms plus the convention center, and how quickly that response was within only 2 weeks. And so I just want to thank the three of you and your staffs for doing just amazing work in this. So I just want to start out with that, so thank you. So the role of philanthropy, so early on, 3-4 weeks ago when this was all getting going, we were talking with Councilmember Ward and Tamara about the hotel rooms were coming on board and things were moving quickly. So we knew that we needed to meet CDC guidelines. We have in our system, and that's not even counting everybody, but in the HMIS system, which is the homeless database essentially, there are over 2,000 seniors, people 65 and older. So we knew that in addition to 2,000 seniors, there are a lot of people who are medically vulnerable and at risk, people who are homeless. And so we knew that we needed to get them either from the shelters into a situation where they had more social distancing or from the street. And so one of the ways to do this is through the hotel rooms that Tamara talked about earlier. And as she mentioned, of the 2,000 the county has, the majority of them are a FEMA response, but there are some that the regional task force has, about 300-400, Tamara, and that the government dollars are not going to be reimbursing us for all of this. And it is important to have those philanthropic private dollars that can help fill the gaps, but more importantly, are very flexible. So what we're hearing from providers who are serving seniors and others in order to have them and serve them in the hotel rooms is these hotel rooms are often very scatter site. So sometimes you'll get hotel rooms where you have a block of rooms in one place, but you have to have case managers, you need to have meals delivered. All those things need to happen in a scatter site type of way. And so some of our providers are even saying they don't even have enough vehicles, and the vehicles won't be reimbursed by government. So that's just an example. So we know that our providers are dealing with staffing shortages. They're dealing with just serving their clients in general, and then they're dealing with unexpected things such as a lack of vehicles and other things you wouldn't think about when you're switching your model from something where you have bridge shelters or other type of shelters that are in one location into a hotel model that is scatter site where people can't leave, they can't go out, they can't even go out. We're talking to our partner at Path, where they were used to serving breakfast and dinner, but now that their clients can't leave the building, they're also adding lunch into that. So now they're serving 3 meals a day instead of 2 meals a day. So that's the kind of thing that affects providers' budgets. So we set up this fund at San Diego Grantmakers through Funders Together. So it is really for identifying, really we're targeting seniors, like I said, and other people at risk to keep them. These are not necessarily people who have tested positive, but they are people who are very vulnerable, and we really need to keep them in an isolated type of an environment so that they will not contract COVID-19. So you can go to San Diego Grantmakers website for additional information or contact me. But that is one of the things we have started doing. And I know, talking with our members of Funders Together and other members of Grantmakers, many of us are kind of adjusting our grant making practices and really working with our nonprofit partners to figure out how we can help them during this pandemic.
Great, thank you so much, Amy. And Supervisor Fletcher, I see you're with us, so we'll
I'm here.
Beam over to you in just a moment. So we've just heard from Council Member Ward, from Tamara Kohler at the Regional Task Force on the Homeless, and from Amy Denhart at Funders Together to End Homelessness, many of whom you've probably heard over the weeks. And Supervisor Fletcher is joining us now to give us that county view as part of this comprehensive and coordinated effort. And we appreciate you being here, and we appreciate your face covering, clearly in evidence there, modeling good behavior. So please go ahead and share away.
Thanks. Would you want me to focus on homeless or just a broader kind of public health update?
We're really focused on homelessness in this particular call.
Okay, perfect. Well, I want to thank Tamara and Chris, City and RTFH in particular. We talk multiple times a day, every day. As it relates to homelessness, we really moved, and when I say we, I mean all of those entities together very, very early. It seems like an eternity ago. It was only 21 days ago that we had our stay-at-home order, but well in advance of that, going back a month ago, we immediately got up hand washing stations, hundreds of them rapidly, trying to learn some of the lessons from the past in terms of the need to move with speed in terms of doing that. One of the next steps that we took right away was getting public health nurses in our existing shelters. I know many of us have had great concern when you have something as horrifically contagious as COVID-19. Individuals in congregate care settings are particularly at risk, and it can literally spread like wildfire. So getting public health nurses into those facilities early, checking temperatures, looking for symptoms, anyone who had them, getting them immediately removed and into a public health motel room. We have a large quantity of public health motel rooms for individuals who are positive, persons under investigation, which generally means they're awaiting testing, or certain individuals with symptoms awaiting additional evaluation. Those individuals who don't have the capacity to self-isolate at home, we wanted to have a place for them with food service, laundry, janitorial, security, kind of all of that wrapped in together. We also worked hard to get public health nurses embedded with homeless outreach teams so that we could go out and proactively find the unsheltered. So we were screening the sheltered and the unsheltered, along with the distribution of hygiene kits, close to 3,000 hygiene kits, that have been distributed by county public health nurses through the homeless outreach teams. Soap, water, hand washing station, hand sanitizer, information on coronavirus, how they could access care and help, along with making sure that these individuals could get tested. So those were a lot of the very, very early stages. We have had a number of unsheltered individuals test positive, but to date, we have not seen the outbreaks that other jurisdictions have seen. But it's something that we are very, very, very mindful of. And then the efforts around Golden Hall and the Convention Center have been a really collaborative approach with the county, city, RTFH all providing funding. Along with this is where I think that there is a great opportunity, is that the county, in embedding our behavioral health experts into those operations to ensure drug treatment services, MAT, behavioral health services, alcohol services, mental health treatment, and really trying to get them into the continuum of care that we've been striving to build over the course of the last year to get better outcomes, can hopefully get some of these individuals on a really good path coming out of this. And then the final point I'll make is I think there's a tremendous opportunity around acquiring motels. And so we had been working on this for 4 or 5 months, and it finally got done yesterday. And that's the Behavioral Health Impact Fund, which the city and county agreed to. We took $25 million of lawsuit money that was in dispute between the city and county and said, hey, we're going to resolve that. We'll put all the money in. So that is now going to be on the streets. It's administered by the county, but it is a joint city-county operation. And that is for any provider who provides behavioral health services, which runs the gamut of alcohol, drug treatment, or mental health. It's $25 million that they can use to acquire a building, expand a building, renovate a building to provide more residential treatment beds. And so we hope that can quickly get deployed. And I think there's a number of these motels out there that are staring down 0 occupancy for March, 0 for April, 0 for May, and questioning at what point tourism will come back to a level that might be interested in selling for a one-time cash payment. And so I know there's a number of other discussions I've been a part of and others are having around the ability to acquire similar type properties as well. So that's kind of it in a nutshell. And we will continue to make sure for the duration of coronavirus that from a public health standpoint, we're doing everything we can to protect our homeless individuals. And also recognizing just one point, we've always made a distinction that we put a lot of ages on, who constitutes a senior that's most vulnerable, but our public health team is very aware that your health age and your biological age, your birth age can be vastly different based on the conditions of your life. And so to make sure we're being sensitive to individuals based on their actual health conditions and not just an arbitrary date of their birthday. In terms of who we think is vulnerable. And that's why we have the additional rooms for high-risk individuals who are unsheltered. So with that, I will stop talking. I would be happy to take any questions.
Great. Thank you so much. And thank you for making that last point, as we all have to be thinking hard about not falling into sort of assumptions and past routines when we respond to a new situation. And the innovation being shown is really inspiring, and I think is hopefully helping people to think about how we might do things differently going forward once we come out of this crisis situation, opening up new pathways. Please do, everybody who is online with us, if you have questions to ask, enter them into that chat box and we will call on you. I'll ask one to start, but I want to recognize a couple of things that we're very conscious of. One is that among the speakers here today, we don't have anybody speaking from the nonprofit providers who are doing such great work, sort of 24 hours a day, all day, every day. And we want to just recognize and acknowledge them as well. And I know that we have a focus on San Diego County, but Imperial County is just to our east, and they are doing a tremendous amount of work as well. And the Imperial Valley Community Foundation CEO is online with us today. So I don't know, Bobby, are you with us? Did you want to add anything to this conversation as relates to Imperial Valley?
Yeah, good afternoon. I don't know if my computer is or my connection is stable enough. It keeps popping me off, so I apologize. Thanks for the opportunity. I didn't plan on speaking, so I won't speak long. We've kind of been tiptoeing around some of the recovery efforts in terms of the community foundation's standpoint, just to really avoid getting in the way of any direct service providing organizations or other people that have monies that already kind of have a strategic placement for and use of those funds. So I think I'm going shaky. Years ago, we set up a regional disaster fund in response to the earthquakes back in 2010, 2012, 13, and some of those recovery efforts. Working with agencies like FEMA, CalEMA, and our local government agencies and community partners. That was a much different time. We were able to kind of plan for and assist displaced families. Currently, we've really just tried to encourage people to continue giving to organizations they would normally support, that count on that support, as well as those that if they're comfortable with a long-term strategy, is it's not going to be a here today, gone tomorrow issue. There's going to be ongoing recovery needs, and we'll find the ways where government needs some help filling in the gaps on some of these programs, and where our partners are feeling a little bit weak or behind the curve. So we're kind of in a holding pattern right now. We have our disaster fund that's available to receive gifts, but we're also grateful for partners like the Alliance Healthcare Foundation, Creole Wellness Foundation, and I think Sierra Health and some others had come forward to provide some immediate response funds for agencies that are providing services related to the pandemic. But we're here and fielding phone calls and connecting people and kind of doing work behind the scenes. But we appreciate being involved and invited to sit at the table on these web conferences. So thanks for having us.
Thank you. Thank you so much, Bobby, for all you do. So we do have a few questions coming in, and I will pose a couple of them and invite any of our speakers to respond. I'm gonna put a few out there so you can pick the ones that you think are most important or most interested in answering. One is about funding overall. We know that there are some very high-profile federal stimulus package coming out. The state is providing relief funds. So the question is about what funds are available that we can tap into to support our region. And then really a couple of questions about the overall state of homelessness. Given the budget shortfalls, how do we feel like that might impact our ability going forward to address the comprehensive issue of homelessness in our region? And do we expect to see any upward trend in that because of the economic situation that might put people out of work for the foreseeable future? I won't wrangle, just jump on in there.
So I'll jump right in and maybe just kick this off. Again, I think everyone's got a perspective and a role that they're playing in this. I am optimistic in the near term because of, I think, the continued focus, especially from federal dollars on down and state resources on keeping our existing programs whole and making sure that we are staying focused on the housing goals that we've been amassing some dollars and some resources to begin to give to local communities. And so I'd like to be able to see that encouragement of those decision makers and those dollars continue to stay flow. I feel like those funding streams are either already in the bank or are a little bit more resilient than some of the local funding streams like hotel tax revenue or something that are enduring our operational dollars. So I'm optimistic in the near term, but we have to come out of this crisis sooner rather than later. We can't have a prolonged economic impact, or I think many of those same banked resources or competing priorities are going to start to kind of change the landscape for more medium and long range goals that we stay committed for on our community action plans.
Thank you, Council Member. Tamara, our supervisor, do you want to add to that? So oh yeah, go ahead.
I was just going to add, as far as the impact of funding for homeless services, we're actually seeing an increase of an investment through the stimulus packages. So we haven't seen a decrease on the continuum of care funding. We aren't seeing a decrease on the federal funds, actually an increase. I think to your point, we will need to balance keeping those who are struggling to pay the rent and do those things out of homelessness. So strong preventive measures and then really being able to hopefully use the opportunities that may exist of having more rental properties available to us, and then really using this funding that's coming from the state, our HAP funds that were already dedicated for a homeless effort, and coordinating that along with the new funding coming from our federal partners with the stimulus package. I think it's the coordinated effort that you're seeing with the county, with the regional task force, and then not only with the city, but other cities as well that will be getting additional funding through CDBG and ESG, that we coordinate and leverage those efforts would be the wisest thing for us to do with new funding, to stretch it to its greatest capacity. And I would follow up on Nathan's recommendation of purchasing some things that are available, that there's an opportunity for us to claw back some of the SRO type things through hotels, and really use this opportunity with the increased funding to make huge strides and maybe investment of properties and capital, not just kind of the short-term rental assistance and shelter.
And I would just add to that, look, there is considerable budgeting anxiety. When you look at the projections around income tax and Mental Health Services Act, when you look at sales tax, at property tax, fulfillment, and you also take into account that as we head into a recession, which we clearly are going to, as revenues to government go down, the demand on services go up. The county has moved very aggressively to really spare no expense in responding to coronavirus, but we are talking about massive expenditures of money, where we are purchasing personal protective equipment on the open market. We are buying ventilators on the open market. We are standing up new hospitals. We are standing up alternate care centers. We really are expending a lot. And then there's a daily stream of now you need to pay for this and pay for that, and a lot of those requests are not related to homelessness. And so I think we are all going to have to really look creatively for what are dedicated sources of funding that are available, what are federal or state, whether they be maximizing like drug Medi-Cal or other types of options, and working creatively with our providers, because there is an opportunity when we come out of this that if we'll make some really wise and strategic investments, we can come out much stronger. But I do think we should all be very aware that we're going to head into a prolonged period of limited availability of traditional government funds that come through the normal tax payment system because of an economic recession. We don't know how long it will last. We don't know how quickly we will recover. But I think we're going to have to really hone in on priorities, with addressing homelessness and behavioral health issues from the county standpoint being one of the highest priorities, along with a recognition of the creative nature of where we're going to have to try to find funding, reallocate funding, redesignate funding, and pool our resources together.
Thank you for that. And I just want to make note from the philanthropic standpoint that some of the things we're seeing, the recommendations that are emerging and the actions that are being taken are for foundations and individual funders to essentially offer the flexibility that nonprofits need, and to partner with our government counterparts to say, you had a grant that had a restriction, we're going to release that restriction as they're needed, and the usual requirement to do reporting. All these sort of things are an option, and anybody who is on the line from a nonprofit who feels that would be helpful, I would encourage you to just have a conversation with those funders. I don't control any government funds, but I would encourage you to reach out to your government partners as well and talk about how flexibility can help you really respond to this need in the best way possible for all of us. Now is the time for us to all be more human, more flexible, more innovative, but sometimes we just have to open up that conversation. The other piece of this I want to mention is the small business aspect. So many of the people that we're working with are business owners and employees, and there are a lot of recovery and relief programs out there for that. You can check out some of them on San Diego Grantmakers website, and so many of our partners in the community are focused on that right now because of the federal money coming out. I will First, ask if anybody who is dialing in on the phone who doesn't have access to the chat box has any questions. There's just a handful of those folks, and if not, we will go to our closing. Seems like not. Okay. So with that, gosh, thank you all so much. Our time is always precious, more so now than ever. We do these calls every Thursday at 3 p.m. Next week, we expect to look at the food security issue and provide an update on the response there. And let's see if I can share my screen again. I will show you our lovely closing slide, which is right here. For the philanthropists on the line, we are doing our best to track what funding is out there and where it's going. We will send these slides out, and you can go to this website and help us do that so that we can all be more thoughtful and strategic in our response, always keeping in mind that having a conversation with the groups you're supporting is the best way to know what the needs are. And that's going to be it. Debbie McKeon, President and CEO of San Diego Grantmakers. Are there any closing words you'd like to say to take us out today? It's possible we lost her. Okay. Well, with that, thanks again, everybody. Have a wonderful day. Stay in touch, stay well, and we're in this together.
Great, thank
Take care.
you.
Thank you.